Dr. Keith Van Zandt and his wife Dee Dee understand the terrible consequences of not vaccinating children against preventable diseases. Their adopted daughter contracted hepatitis B at birth in Romania.
We brought her home and began working on her medical care. Her first year home was an endless line of liver biopsies, hospital stays, blood draws, and over 150 painful injections to get the infection under control.
But the Van Zandts realized they were fortunate to get their daughter medical care. They are now speaking out on behalf of the nonpartisan advocacy group ONE.
Personally, it still sickens me to know that the disease my daughter has was completely preventable by a simple vaccine had that been available to Annie and her mother.
What's the point?
Where's the proof? Actually, smart programs are saving lives.
With this video, ONE has launched their Why Bother Childhood Vaccination Awareness campaign, urging U.S. leaders to help fund pneumonia and diarrhea vaccinations for 243 million children around the world. ONE Communications Director Jenny Wolf says the needed funding for vaccinations is less than 1% of the U.S. federal budget.
So over the next 5 years, we can save an additional 4 million children for what I'll just say is a minuscule part of the federal budget.
Vaccinations have already prevented the deaths of an estimated 5 million children around the world. ONE, its partner, the Global Alliance for Vaccinations and Immunization, and other organizations hope to continue this success.
The effectiveness is great. What we're going to try and do is provide vaccines at a reasonable cost to countries in the developing world so that we can create access for parents to have their children immunized against what otherwise would be deadly, sometimes, diseases.
ONE is not alone in their campaign. During 7 days ending April 30th, 170 of the 193 World Health Organization member countries were taking part in Immunization Week activities. Spokesman for the World Health Organization's Americas Division, Dan Epstein, says hundreds of thousands of people have been vaccinated.
A main obstacle for us is when people don't know that their kids should be vaccinated, or don't know that, for example, adults should be vaccinated against influenza. So awareness is one of the biggest obstacles we face.
Epstein says there are still many hard-to-reach places along borders and in rural areas in the Americas. And there are many challenges in transporting vaccines, which often need to be kept refrigerated. The Pan American Health Organization set a goal of vaccinating 41 million people in the Americas between April 23rd and April 30th. And for the first time, Africa and the Western Pacific region also held WHO-supported immunization weeks. For VOA News in Washington, I'm JulieAnn McKellogg.
Additional $17.5 million is open to the